Hi, my name is Arvina Grahl. I'm a postdoc in the Napadow lab at the Martinos Center in Boston, and I'm presenting some preliminary data of our study entitled Brain and Behavioral Correlates of the Patient-Clinician Relationship. This is a longitudinal fMRI hyperscanning study of chronic pain patients with fibromyalgia. So we are interested in non-specific treatment effects, as the literature shows that they're strongly influencing outcomes of clinical interventions. And we're focusing especially on the patient-clinician relationship. And to investigate those social interactions, it requires a two-person simultaneous dual brain approach to actually target like a biopsychosocial approach to have a look at this concept. So we're interested in the brain-to-brain communication between the patient and the clinician. And we're doing that by using two MRI scanners, and we're putting one of our clinicians who are acupuncturists in one scanner and one of our fibromyalgia patients in the other scanner. And they're connected via a live video stream, so they can see each other while lying in the scanner and being scanned. And our acupuncturists will then treat our patients with electroacupuncture by button presses. And the aim of our study is to investigate behavioral, neural, and clinical outcomes following a longitudinal development of a patient-clinician therapeutic alliance. And we're especially interested in the dynamic coupling and social mirroring areas in the brain, as they are associated with concepts such as empathy. So how did we do that? We obviously used a longitudinal study design. So we have a 3-week, 6-visit acupuncture intervention where our acupuncturists build a relationship with their patients. And we divided them in 2 groups. So we train our clinicians to either use an augmented interaction style, being very friendly, very warm, and very personal with the patients, or more limited, more business-like interaction style and acting more neutral with them, to create some variability and see if this actually makes a difference in the outcome of the intervention. We're scanning those diets 2 times. We have a pre-intervention and a post-intervention MRI scan. And what we're doing during the scan is that we deliver evoked cuff pressure pain to our patient's leg. And the clinicians, the acupuncturists, are able to treat them for some of the trials or to not treat them with electroacupuncture. And then we have a look at the pain ratings of our patients and want to know if that actually makes a difference. So what you can see here, this is the limited interaction style. So you can see that in the baseline, before the intervention and after the intervention, the treated and non-treated trials are not really rated that differently between the patients. But for the augmented, we see a slight trend that in the post-MRI, after the intervention and after building a warm relationship, there's a slight decrease in those ratings. So it seems to be beneficial for this group compared to the limited, where it's not that case. We also have some other outcome variables that we're interested in. So for example, the therapeutic alliance is rated by our patients and by our clinicians. The higher, the better the relationship. That's how it's considered in this measure. So you can see assessed during the 1st, 3rd, and 6th treatment session of acupuncture that the ratings are much higher in the augmented group compared to the limited group. Same for the ratings of the clinicians, but they are obviously not blinded. We didn't see any differences in the perceived competence that our patients reported of their clinicians. So that was the same for augmented and limited, but the warmth level is obviously very different. So our augmented clinician style was perceived much warmer than the limited one. For pain catastrophizing, we see a slight trend that in the augmented group, it seems to be beneficial and helps decreasing the pain catastrophizing, but this is not the case in the limited group. Future analysis, when we have more diets that we can actually analyze, we'll target dynamic brain concordance. We have facial expression data and physiological data, but those preliminary results actually show how important it is to pay attention to the interaction style and that a warm and empathic style might be beneficial for the patients. We already have one publication out there. This is by Dan-Mikael Ellingsen in Science Advances. That's not a longitudinal study, but check this out if you're interested in this topic. I want to thank our lab. It is not possible without all those wonderful people to do such a difficult study. our picture changed over COVID times, and it's very difficult to do social interaction research during COVID, but we got lucky and found those clear face masks so we can actually continue scanning our patients' clinician diets now. So that's it from me. If you have any questions or you want to discuss anything, please reach out to me. I'm very happy to chat about it, and I hope I hear from you. And bye-bye.